I'd like to give each of you the chance to offer some words of wisdom or guidance to others who may be in similar shoes. You've already shared so generously of your experience, your time, but if there's anything else you feel, yeah, maybe there was something that you would have helped you to hear when you were in your journey. Like to give you the chance to do that.
Well, I just encourage people to break through that stigma and the fear and the shame and ask for help. Uh, I couldn't do that until it was, my way rock bottom. It doesn't have to be that way. Get help early. There are so many, as April just mentioned, there are so many different options for you out there. Please reach out. Please get some help and support. And feel free to reach out to either of us. We're all over on the web. You can Google our names and you'll find us. So connect and heal.
We are not hard to find. I want to say again, and you've heard me say it before, your behavior does not define you. I was not ever told that until I made it to the rooms of recovery. And if I could have maybe just heard that message on my journey to recovery, my journey to recovery maybe would not have had to look like almost 30 years. I don't know, but I hope that someone hears that today, that your behavior does not define you and that this is not a moral failure. Again, this is a complex medical condition and it involves both biological and environmental factors. As nurses, you understand what I mean by that. You are worthy of the help, like Kristen said, that's out there for you, but you are highly skilled. You are compassionate. You are a loving professional because you are a nurse. I know that because you are a nurse. You can be healthy and you can be whole again. And if you take our not advice, but our gentle suggestion to rediscover your strengths and your purpose and your ability through recovery, the promises are there and the resources are there. It just might not look and feel like they are, and they can come true in your life.
Well, I find that encouraging as well, and that the journey to health and healing and wholeness is for all of us. Um, so, as a final, to end us off maybe today, I want to read another piece of Kristen of what you wrote in your book, which I just thought was so beautiful. You write, "What she didn't understand is that it isn't what you have, or what you accomplish that gives you peace. The peace has to come from within." It would be many painful years before she would learn that. She has always been looking for peace, but peace isn't something you look for. It's something that comes from you living the right way. And so, for both of you, you've gone through this journeys, you've returned to your role as nurses, but you're also mothers and wives and partners. How has the sense of peace that you've discovered influenced both how you approach your personal life and your professional life?
Well, I continue to look for that peace. The difference is I find it now, most days anyway. Uh, I know I'm on the right path in my life, which gives me a great sense of peace. I do the things I do during the day to help myself, to help others. It keeps me moving forward, wanting to do more. It gives me encouragement. I living the right way, doing those right things. Uh, the peace just comes, and it's beautiful. It really is beautiful.
They say, and I heard in AA and other recovery programs that I've been in, just join us. It's not a big deal. It'll just change your life. That's all. And that's what it did, is it changed my life and it transformed me. And my emotions were so big when I was a little girl, and throughout my journey of problem drinking and recovery, I've learned how to stabilize them. I've learned how to put them where they belong, and I have had clarity of mind in addition to the peace. I've had a whole new perspective on life. I'm wearing a whole new set of glasses, as they say. I have an opportunity now to be self aware. I have an increased integrity and ethics when I provide care to others and myself that I did not have before. And my coping skills have strengthened to the point where nothing really can shake me. My mother just passed a couple of weeks ago, and my wounds and my mourning is open and fresh from that. But I'm able to face it with ground and a foundation of coping and of strength and promise. And had I been drinking when this all happened, and had I and if I'm drinking when anything big in life happens, I don't have that peace and that clarity of mind and that emotional stability, and it's a much better way to live.